Hi, welcome to the COVID-19 Lake Norman and North Mecklenburg briefing call. Today is Friday, April 24th, 2020. My name is John Bradford. I'm your briefing call moderator. I'm a small business owner. I have two businesses right here in North Mecklenburg, and I'm also a former member of the North Carolina House of Representatives. The purpose of these calls is to bring together healthcare experts, government officials, and business leaders to provide regular COVID-19 briefings to update, educate, and support the North Mecklenburg region during the outbreak. We are still under President Trump's social distancing required guidelines through April 30th. As you can see from the graphic, just be smart, social distance, and you can see what can in fact have on helping to flatten the curve. President Trump and the CDC have issued guidelines opening up America again. And the idea is it's a three-phased approach based on the advice of public health experts. These steps will help state and local officials when reopening their economies, getting people back to work, and continuing to protect American lives. These three phases are based on symptoms with downward trajectories, the same thing with cases, and also with hospitals. Last time we had our call, the Senate had voted to pass a second stimulus package of another $484 billion. Yesterday, the House passed it. So that means this bill is now moving forward to President Trump's desk for final ratification. So you may say $484 billion, that's a lot of money. So what's included in the package? It's a $320 billion for the payroll protection program. This is on top of the first round of $349 billion that was exhausted in 14 days. And there are still a lot of business owners out there that did not get any funding help through the PPP. So this $320 billion will help that. There's another $60 billion for the Economic Injury Disaster Loan program, also known as EIDL. There's $75 billion going to hospitals and healthcare providers, and $25 billion allocated for state-level COVID testing and research. The last time we had our call, I mentioned this. I think it was noteworthy, so I want to mention it one more time. LabCorp, that's a North Carolina-based company. They received FDA approval for an at-home coronavirus test. The name of the test is called Pixel. It's going to be $119, and it will include the collection of specimens using nasal swabs. The test is being marketed to healthcare providers and first responders, and consumers will be able to buy the test if you're recommended by a provider and after they have filled out a questionnaire. So I think it's amazing that the FDA was able to fast track this, and I think it's more amazing that LabCorp is a North Carolina-based company, and this is the first at-home coronavirus test of its kind. So if you have a reason that you think you need to be tested at home, I would contact your healthcare provider and see what you need in order to have access to this particular test called the Pixel. And again, it's $119 is the cost of the test. Just because we're talking about testing, you can go to the cdc.gov website, and there is sort of a self-checker to try to help make sure you're making the best decisions about seeking appropriate medical care. And then there is, of course, the CDC and Apple have developed a screening tool to screen yourself or to use it to screen someone else. This is just a tool, right? It's not medical advice, but it is trying to help guide you appropriately through the pandemic. You can go to apple.com/COVID-19. There's still a recommendation by the CDC to wear face cloths, cotton face cloth coverings. There are several, I think, companies selling these. One that I have talked about a lot is Endera Mills. You can get masks, $2 a piece. You have to order a minimum of 12, and you can go to the website shop.enderamills.com. I have some. I ordered some. They're great masks. You can wash them, reuse them. So if you need masks, I would encourage you to go to shop.enderamills.com. Endera is spelled I-N-D-E-R and then Mills. In terms of the U.S. total, this is from CDC. We have 828,000 cases of the coronavirus, and we've had 46,000 deaths. And from the heat map you see on your screen, there are several states that are very rich in color. North Carolina looks like we're about middle of the pack, so we're definitely not any of the most impacted states, but we're also not the lightest state. So this heat map kind of gives you an idea of the impact across the country. There is a website for rumor control. It's FEMA.gov, Coronavirus Rumor Control. I encourage you to go there. Don't be scammed. If you haven't received any financial assistance, the money's on the way if you're eligible. It should be directly deposited into your accounts. The IRS, the Department of Treasury, they know who you are. If someone is calling you trying to obtain personal information of any kind, you are probably being scammed. In fact, I would just count on you being scammed. You should not be giving that type of information away to anyone. So please, if you have questions, go to the FEMA Rumor Control website. There's no new rumors as of our last call, but I think it's important to let you know this. North Carolina is still under a state of emergency. We're going to talk a few minutes about the new extension. There's a hotline as well as 211 on your cell phones for assistance. These numbers are just released a few moments ago. North Carolina, we have 8,052 confirmed cases with 269 deaths. That's up from Wednesday at 242 deaths. And in terms of hospitalization, we're up to 477 currently hospitalized. We were 434 on Wednesday. So those numbers are slightly up. One number that's held consistent is the number of counties impacted. We still only have 93 out of 100 counties impacted. That number has held now for a little bit over a week and a half. So out of the 100 counties, 93 have been impacted, and that number seems to be holding. So let's talk about the new Executive Order 135 announced by the governor yesterday. He has extended the stay-at-home order through May 8th, so that's an additional week beyond the current stay-at-home order, which was to last through the 29th of April. But there's a three-phase approach to reopening. Phase one is basically the stay-at-home order remains. People can leave home for commercial activity. Retailers and services still need to implement social distancing, cleaning, and other protocols. Gatherings are limited to no more than 10 people. Parks can open subject to gathering limits. Face coverings are still recommended in public. Restrictions remain in place for nursing homes and other congregative living settings, and encourage continued teleworking. Now, it is a friendly reminder that Mecklenburg County at the moment does have their own order, and you have to follow the most restrictive order. So the county, for example, has closed its parks to vehicular traffic, although the state order says parks can open. So you must follow the more restrictive order. Phase two, which will happen after phase one, which would probably last for another 2 to 3 weeks after phase one, will lift the stay-at-home order with strong encouragement for vulnerable populations to continue to stay at home. These would be people with asthma problems or heart conditions or seniors or maybe people with obesity, things like that where you're higher risk. There will be allowed limited opening of restaurants, bars, and other businesses that can follow very strict safety protocols with reduced capacity. Gatherings at houses of worship and entertainment venues with a reduced capacity. There'll be an increase in number of people allowed at gatherings, open public playgrounds, and then continue rigorous restrictions on nursing homes and other healthcare settings. And then we'll go to phase three. And this will be probably another 4 to 6 weeks after phase two. This will again be to reduce or lessen restrictions for vulnerable populations with an encouragement to continue physical distancing, to practice social distancing, allow increased capacity at restaurants, bars, or other businesses, houses of worship and entertainment venues, further increase the number of people at gatherings, and then continue the rigorous restrictions on nursing homes, congregational type limits. So this phased approach, 1, 2, and 3, is sort of an easing back into it. Now, the governor does have the ability to, even though phase one is through May 8th, that is subject to be extended by another week if the state decides. But as of today, it's through May the 8th. Now, North Carolina still needs healthcare volunteers. There's a website here for you. And if you have questions regarding state unemployment benefits, whether you're an employer or the employee or former employee, please go to this website that you see on your screen. In Mecklenburg County, the latest data that I have is 1,377 positive cases with 37 deaths. Of course, our stay-at-home order in Mecklenburg County is through April 29th. Again, our order is more restrictive in some areas than the state. This has created some confusion, no doubt. I've heard from people, especially with different types of businesses that are essential at the state level, but not essential at the county. Now, the county manager, I believe, is recommending to extend the county order through the 8th, along with the state. The challenge is the county is going to needs unanimous consent with the 6 surrounding towns. And I do know some of the towns are hesitant to just go sign this order when they have businesses that can't open in their town. But if we go just across the county line to Iredell County or Cabarrus County, those same types of businesses can open because the state order is different than the county order in some areas. So we'll see how that plays out. So the order may or may not get extended based on if all 6 towns support the county manager's recommendation. Mecklenburg County parks continue to be closed to vehicular traffic. I will tell you, I try to get out and walk my dogs and I see a lot of people parking on side roads. Please don't block driveways. Be cognizant of emergency vehicles. So don't double park on both sides of the street. Walk-in and bicycle traffic remain permissible. There's a Mecklenburg County heat map right here on your page, on your screen. This is still as of April 16th. So I realize this is a few days old, but it's the latest data that I have. In Huntersville, there's between 36 to 49 cases. In Cornelius, 20 to 35 cases, and in Davidson, 5 to 20 cases. And if you look at those cases based on population, it's a pretty similar picture that we're painting here. But I did want to share with you the heat map that I have, which again is as of April 16th. Lake Norman, the Lake Norman Visit Lake Norman group. These guys are real leaders. They have a virtual tip jar. Right now, our hospitality workers aren't working. Obviously, they're trying to do takeout and delivery, but they're not getting the same level of tips because we're not eating in their restaurants. So there's a virtual tip jar. If you go to visitlakenorman.org/restaurants, every time you visit, there's a new person being featured for these virtual tips. So this is something that perhaps if you find yourself wanting to help these individuals, this is a great place to do it. Today is Friday, and I wanted our panelists to have a break, so I'm doing this call on my own, but I do want to take a moment to thank our standing panelists, U.S. Congressman Greg Murphy, Dr. Jack Faircloth, who's a medical doctor in Huntersville. We've had the director of the United States Small Business Administration for North Carolina join our call every Wednesday, Mecklenburg County Commissioner Pat Cotham, Cornelius Mayor Woody Washam, Huntersville Mayor John Anarella, Davidson Commissioner Matthew Fort has been joining our calls as of lately, so it's great to have him. CMS board member Rhonda Cheek has joined our calls a handful of times, but she has continued to provide updates. And then Bill Russell, the CEO of the Lake Norman Chamber of Commerce, has been on every call. And of course, my name is John Bradford, and I've been your moderator. You can find these calls on Elect Bradford. If you're on Facebook, go to Elect Bradford. I post them there. You can email me at lkntogether@gmail.com. We are stronger together. We will reconvene our panelists on Monday, April 27th. Hopefully we're in for a nice weekend. I want you to take care of yourself, take care of each other. And if you have any questions or concerns, keep the emails coming to lkntogether@gmail.com. Thank you for listening. This does conclude today's briefing call.